That is a very tough question, and it's a conundrum type question that we're facing on a daily basis. We are sometimes utilizing, many times, opioids because we don't have anything better, unfortunately. There are other times that is lack of knowledge or lack of knowing what other available options we have out there. And one of the things that I have been trying to stress whenever I am meeting with other practitioners, doing talks, etc., is trying to explore all the other options that are available, because when we like to the use of chronic opioids to only occur when we have exhausted many other alternatives that we may have. Unfortunately, sometimes we get there and we don't have anything else. And that it would be ideal if we have other additional options that were effective and safe. But unfortunately, sometimes we don't. I think that the medical community should be mindful of costs, and we need to understand that we are in a real world where costs are important, but we should also be advocates for our patients and look at the fact that if something is effective and is safe, even if it costs more, we should advocate for the patients to get there. And we should try to advocate with insurance companies and any other payers to do that. Unfortunately, in the past, many times people have actually used the newest thing without really knowing if it's effective or even safe. And we've been burned in the past with using things that are potentially more expensive and may not be as effective as cheaper alternatives. So I think we have to be responsible, but we also have to be advocates for actually obtaining those things for our patients. I think that the elimination of pain as the fifth vital sign, I am a proponent of it. That's a phenomenal idea. I think it's a great idea because it really is not a vital sign. I think that the intent that the Joint Commission had when they started with this movement was to raise awareness and make sure that people were evaluating it and assessing it. That is completely different than actually assigning a number that is completely meaningless in the sense of being objective. It's completely subjective, and I think that we raise enough awareness that people are aware of it, and we don't need a vital sign for it because we do not have vital signs so that it can be actually measured. So good idea. I think that the awareness has been raised. I'm a proponent of that, and it's important that people continue assessing it the best way we can, and we definitely need to use more functional assessments of pain, not just the number.